New tool at Thomas Hospital is helping doctors perform more precise knee and other joint replacement surgeries. Dr. Jason Determann from Bayside Orthopaedics is here to talk more about that, and thank you for coming in today.
Thank you, Lenise, for having me.
So this is what you do, and you love your job, and it is really neat when we get new tech to help make your job easier.
Absolutely. This is, it's easy to go to work when you wake up every day and look forward and love what you do. The technology that we've been able to bring to the community has really been exciting for myself and other surgeons in the area.
So talk to me first about, who is a candidate for a knee or hip replacement surgery? It's a big deal when you make that decision. It is.
I mean, it's a life-changing decision that you make. Patients who are candidates for hip or knee replacement are patients who have got diagnosis of arthritis, and there's lots of different forms, but when that arthritis gets to the point that affects their quality of life, and that can be broadly interpreted, and as we've developed techniques and implants, we've been able to expand those indications to where it's not just for the 70-year-old healthy male or female with bad arthritis. We're able to use these techniques to benefit a lot of other patients these days.
And so this new tool is robotic surgery, and it is helping you to go in there for those knee replacements, and it's relatively new for Thomas.
It is. We were able to adopt the technology earlier this spring, and since starting in April, we've done over 100 of them at Thomas and Mobile Infirmary as well, and it's been a very big plus to our community in terms of how we can bring this technology to our patients.
Yeah, and you're not just limiting it to knee replacements for the robotic procedure, others as well, yes?
Yes, ma'am. Computer navigation and planning has grown in the orthopedic world immensely over the last decade, and so we're using modern day technology right there with us in the operating room to expedite things.
And that precision, I would imagine, cuts down on the recovery and helps the transition to be a little easier for the patient. It
does. There's a lot of evidence showing how fine, precise we can be using these robotic techniques, and the VELA system that we use at Thomas and Mobile Infirmary has got the accuracy and the precision to a ½ degree to a ½ millimeter, and so we're able to use that technology to truly customize that knee or that hip replacement to that individual.
What are you seeing more? Are you seeing more of hip replacements, knee replacements? What's the number looking like locally?
Yeah, so locally it'd be hard to tell. I tell you, it's growing. Absolutely. I mean, knee replacement is going to be the most common joint that we replace. Is simply in the United States there's 800,000–900,000 done every year, and that's only growing.
And the recovery time in general? Yeah,
so the recovery is significantly better than what people tend to think, and I think that's a lot in part due to our robotic technology. You're out for a couple weeks, you need some help. Every patient at the end of the road, they're smiling, saying thank you, saying I wish I should have done it earlier.
Right, yes, I've heard that a lot. I should have did this and done it sooner. So
absolutely.
Thank you so much for coming in and sharing this technology and the information with our viewer.
Lenise, my pleasure.